government is disadvantaged also in ordering because we cannot make down payments, no? We have been borrowing money, and so we are at the tail end of the orders. Anything that the private sector orders, and even the LGUs, are savings for the government. It behooves the government to really make it easy for the private sector to be able to import the requirements of their people.
That was the Philippine Chamber of Commerce and Industry. With private employees at the back end of priorities for inoculation, the Chamber is now urging government to allow the private sector to directly buy vaccines.
But even if they say that this might mean savings for the government, the palace says they can only purchase vaccines via tripartite deals. Good evening, I'm Gretchen Ho.
And I'm Ed Lingao. You're watching The Big Story. We begin with the private sector urging government to allow them to directly buy vaccines from manufacturers to speed up the country's vaccination drive.
But the palace again rejects the move. The government says private companies should stick with tripartite deals. JC Cosico has the big story.
For almost 2 weeks now, the country's vaccine stockpile remains at 1.1 million doses. The government is expecting some 2 million doses more by month's end, a combination of Sinovac and AstraZeneca shots. But the private sector wants to speed up the process. This as they seek the vaccination of economic frontliners.
The government is disadvantaged also in ordering because we cannot make down payments, no? We have been borrowing money, and so we are at the tail end of the orders.
In an interview with One News, Philippine Chamber of Commerce Honorary Chairman Sergio Ortiz Luis says the sector wants to directly procure shots and do away with tripartite deals with the national government. He says this will quicken negotiations, especially with counterpart pharmaceutical companies. Not to mention, the move will save the government some money.
Anything that the private sector and LGUs import will be a saving. So I think it behooves the government to really make it easy for the private sector to be able to import the requirements of their people.
Ortiz Luis said this will also help them vaccinate employees who are way below the government's priority list. Former Health Chief Esperanza Cabral tells 1PH that she supports the move.
Ang aking prinsipyo dyan ay kung sino ang makakagawa ng mas mahusay at mas mabilis na pag-aangkat at pagbibigay ng bakuna, ayun ang dapat gumawa.
But as for Cabinet Secretary Carlo Nograles, the private sector only has to wait a little longer. He tells Totoo Lang that the workforce may be inoculated by the third quarter, just in time for arrival of vaccines through tripartite agreements.
Dapat within the second quarter, which is April, May, and June, and nandun na tayo sa senior citizens plus essential workers and some of our, or nakapag-umpisa na tayo sa indigent population. Para pagdating po ng karamihan ng mga doses na prinamis through the tripartite agreement, with the LGUs, with the private sector, sa third quarter.
The palace tells the private sector, stick with tripartite deals.
Allowed po mag-import ang mga private sector. Kaya nga lang po sa pamamaraan ng tripartite agreement. Hindi po gobyerno nag-i-insist on the tripartite agreement. Sa mulat-mula po, hindi po natin pinipigilan ng private sector, pero gustuhin man nila, they cannot go to a manufacturer and purchase on their own.
Presidential spokesperson Harry Roque also reiterates that vaccines are not yet approved for commercial use. For News 5, JC Cosico, we are One News.
But what are the odds that the government will heed the private sector's call? And to discuss this further, we have One News' business editor, Regina Hing. Reg, thank you for joining us. Let me start off with this. Is it fair to say that the PCCI and the business community is getting impatient with the government's vaccination drive, that it wants to skip the tripartite deals?
Hi, Ed. Good evening. Good to have you. Well, thank you for having me, rather. I would say that the mere fact that a major chamber of commerce went so far as to issue a statement is a sign that there are members that are getting a little bit impatient, because usually the chambers are happy to take the government lead on major efforts. Also, you were running sound bites of PCCI Honorary Chairman Sergio Ortiz Luis earlier. When we spoke to him this afternoon, and it was a quite substantial conversation, he did also specifically say that rather than waiting a year for the vaccines, they wanted to buy vaccines directly for their employees because the business sector is really not doing so well. In fact, he says that a lot of them thought that recovery would be underway already at this point, but now look where we are. We're dealing with localized lockdowns again. There's a lot of uncertainty with all of these new variants. So that's what they're getting to at this point in time, which is that they don't want to waste another year, I guess, waiting and taking a wait and see approach. He says there's also a lot of businesses that are borrowing money just to continue their operations. I guess they're trying to ride out this economic slowdown, but at this point, they're becoming discouraged from continuing, which is really worrisome as well. I think the PCCI's point really was that not only does the government have limited funds to hit that all important target of inoculating 70% of the population this year, but it's also hampered by all sorts of regulations and all sorts of legalities, precisely because it's working with national funds and donations. So
Yes, that's correct.
this is where the
Yeah.
private sector is willing to step in, and he even said that they're willing to pay double for the vaccines if it comes to that, if only the national government would allow them to go ahead.
Yeah,
And-
right. But speaking of legalities, but that's also precisely the point. I suppose I do remember that the government is saying that you would need a commercial license of some sort for private sector to buy these vaccines without government's participation. I'm wondering how that factors in, if that was even considered, at least when you were discussing this with the PCCI.
That's right, Ed. There's a key difference. There's a key distinction that Iraq is in quarantine at the moment, but he has, I guess, been consistent in saying that they've said it over and over again. They cannot allow the private sector to go ahead and purchase vaccines directly because all these vaccines are not available for commercial use yet. They're just under what's known as EUAs,
The
or
EUAs.
emergency use authorizations. And for that matter, the national government has to be involved every step of the way. So look, if the question is what are the chances that they may be allowed to go ahead, I think at this point in time, it doesn't seem very likely.
Yeah.
Ed.
Okay, important insights coming from our One News business editor, Regina Hing. Thank you, Reg.
These are the other big stories tonight. Despite the death of a medical frontliner who received a COVID-19 jab, the health department sees no reason to stop inoculation as the healthcare worker died of COVID-19 and not due to the vaccine. The Agriculture Department has formally recommended that a state of national emergency be declared to address the spread of the African swine fever. The proposal provides for a 1 billion peso contingency fund. And it's not just Metro Manila. The nearby province of Bulacan is also imposing a month-long curfew to arrest the increase in COVID-19 infections. These big stories right after the break.
Good evening. You're still watching The Big Story. Another controversy hounds the country's inoculation drive after a health worker died after getting her first jab of the vaccine. But the health department says the rollout will continue. Greg Gregorio with the story.
Despite the incident of a vaccinated health worker dying of COVID-19, the health department sees no reason to suspend a nationwide rollout of vaccines. Officials stress the death of a 47-year-old female healthcare worker had nothing to do with the jab.
There's no changes in our protocol. And also, if you will look at any other country in the world, we don't do testing prior to vaccination.
On February 22, the healthcare worker tested positive for COVID-19, then tested negative a day after. The Committee on Adverse Effects said the positive result may be due to a remnant of the patient's previous COVID-19 infection. Under current protocols, those who tested positive for the virus may only be inoculated 90 days after their recovery. This is so that the natural antibody would die down, ensuring efficacy of the shots. More than a week later, she received her first dose of CoronaVac. She was vaccinated despite her medical conditions, including hypertension, diabetes, and bronchial asthma. This is because she was not under any medication and her blood pressure was also stable. She did not exhibit any symptoms during the day of vaccination. However, she manifested symptoms on the days that followed, and on March 8, she tested positive for COVID-19. She earlier refused to be admitted to a hospital, but on March 10, she was confined due to her condition. 3 days later, she succumbed to the disease. NAFIC Vice Chair Dr. Romel Lobo explains that a virus has an incubation period.
To develop the symptoms after vaccination, the exposure would have is responsible for this. The COVID-19 virus could be responsible for all the symptoms and could have explained all the manifestations that the patient had.
FDA Director General Eric Domingo also explained that the body is still developing the antibodies needed to fight the virus after the first jab.
During the first few weeks after you're injected with the vaccine, you have no protection. If this is the time that your immune system is trying to develop.
Full protection from the virus only comes after the second dose, says DOH Technical Advisory Group member Dr. Edsa Silvania in an interview with Radyo 5. NAFIC also clarified that vaccines cannot cause an infection as these use dead virus. The FDA said they have notified Sinovac about the case. For News 5, Greg Gregorio, we are One News.
Officials are split on whether to wait for the arrival of more vaccine supply before using up the country's current stock. National Task Force Deputy Chief Implementer Vince Dizon tells One News' agenda that it would be more prudent to wait for additional supply. But speaking to 1PH's Sa Totoo Lang, Cabinet Secretary Carlo Nograles says the WHO itself has given the go signal for the use of 1.1 million doses to vaccinate frontliners with their first jab.
Kailangan po nakareserba po yung pangalawang dose. Dahil na po, wala pa pong kasiguruhan yung pagdating ng mga susunod na delivery.
Ang sinabi sa amin ng WHO is pwede na raw namin pakawalan yung ating natanggap na AstraZeneca kasi meron na daw coming na bagong shipment.
DOH vaccine expert panel member Ron Jean Solante agrees that using up the current stock for the initial dose would be more efficient. But Solante says the government should ensure that more supply would arrive within 12 weeks of the vaccine's rollout.
Sa datos nung sa AstraZeneca, the partial protection after dose 1 is like 72%.
Yeah,
that's still quite high.
A new quincentennial marker was unveiled at Calicoan Island in Guian, Eastern Samar. The historical marker in Ngolos is one of the over 30 markers in the country identified as part of the first circumnavigation route. The National Historical Commission has earlier unveiled markers at the Suluan and Homonhon Islands. During the unveiling, President Duterte expressed admiration for our ancestors' generosity in helping the Spanish troops upon their arrival. He called the Filipinos to not allow invaders to compromise our country's sovereignty. Time for our next plus look at some of the day's big stories. The Agriculture Department submits to the Palace its recommendation to declare a state of emergency amid the African swine fever crisis. The declaration will let the DA implement biosecurity measures and rehabilitation programs for the hog industry. The agency also seeks to make use of 1 billion pesos in contingency fund. State-run PTV is now on a skeleton workforce after going off-air yesterday due to an outbreak of COVID-19 cases. PTV says it is already conducting extensive disinfection in its offices. The network's flagship programs Laging Handa Public Briefing and Ulat Bayan will resume broadcast on March 22. And pro-democracy figures join forces in Isambayan to field a unified opposition in the 2022 elections. Retired Supreme Court Associate Justice Antonio Carpio is at the helm of the coalition. Carpio says Isambayan already met with prospective candidates including Vice President Leni Robredo, Manila Mayor Isko Moreno, and former Senator Antonio Trillanes. Time for another quick break. When we return. With more than 1,000 active cases, Bulacan will also impose a month-long curfew. And with volleyball season set to start soon, how are teams preparing under the new normal? A look at their training after the break.
Good evening. You're still watching The Big Story. A Mandaluyong judge appears to be red-tagged in a tarpaulin along EDSA after freeing 2 activists and clearing them of charges. Mobile journalist Pamela Vasquez giving you a front seat to the story.
On Tuesday, TARPs appeared along BC EDSA, thanking a Mandaluyong city judge for ordering the release of activists whom government accused of being members of the Communist Party. The photo and name of Judge Monique Ignacio was posted prominently on the TARP.
The TARPs were obviously made to appear that they were made by the communist rebels as a way of thanking the judge for setting their colleagues free. But at this point, no one seems to believe that.
Printed on the TARPs were logos of the Communist Party, the New People's Army, and the National Democratic Front, all targets of government's crackdown against the left. Even the Integrated Bar of the Philippines called the idea preposterous.
Nakalagay sa TARP mula sa CPP, NP, NDF. Yun ang nakalagay sa TARP. Do you believe that that really was the source of this, or do you think it was something else?
It is preposterous to think and they would do that.
The IBP says someone is trying to intimidate judges who, like Ignacio, handle cases of militants and activists.
Even the judges fear that once your name is there, you feel threatened. You feel violated, not only for yourself, but including your family.
Even the rebels, who supposedly put up the TARP, say they had nothing to do with it. A rebel spokesman said, judges who make decisions against the government are being depicted as supporters of rebel groups. Malacanang Forest Part assured the judge of protection if she is being threatened by any group. Presidential spokesperson Harry Roque said they had no idea who put up the tarps.
I refuse to conclude na red tag na po si Judge Ignacio. Pwede makakalaban din ng gobyernong gumawa niyan para ibintang sa gobyerno.
The IBP says it expects Ignacio and all other judges to do their jobs fairly and impartially, despite the controversial TARP. But in the end, he says, judges are only human, who also fear for their lives and that of their families. I'm Pamela Vasquez, and we are One News.
Let's take a look at the biggest stories on print and online. From the Philippine Star, effective immediately, the Boracay IATF has approved saliva testing as an alternative to nasal swab testing for travelers. But the local task force stresses that saliva tests can only be administered by the Philippine Red Cross and other DOH and FDA-accredited laboratories. The move is expected to boost tourist arrivals in the islands. Business World reports the Toll Regulatory Board is validating if Skyway Stage 3 is indeed 97% complete. This comes after a row between San Miguel Corporation and the TRB on the collection of tolls. SMC President Ramon Ang earlier said their agreement states that they can start charging toll fees at 95% project completion. And this from News 5, the province of Bulacan is implementing a month-long curfew and liquor ban. The curfew will be from 11 p.m. to 4 a.m. These policies will be in place until April 17. Bulacan Governor Daniel Fernando says this is to curb the surge of COVID-19 cases in the province. And as of Wednesday, Bulacan logged a total of some 14,000 cases, more than 8,000 of which are active. For the big story in sports, teams competing in the upcoming PVL Open Conference are now back to Buhay Volleyball, kicking off respective trainings in the new normal. I tagged along to see what new procedures are and to get other insider info on the games likely taking place this May. Please watch this. From serves, receives, and spikes, the country's volleyball players are finally back doing what they love. Training has started ahead of the return of Philippine volleyball via the Premier Volleyball League Open Conference. While excitement is at an all-time high for the league's first ever professional season, the number one thing to keep in mind is safety first.
Sana maging maganda yung simula. Tulong-tulong lang para mas maging maayos.
Extra health safety measures are in place during training, such as temperature checks, online health declaration via QR code, and the shower room is off limits, meaning players have to be in training wear. Each team is divided into 3 batches, with 5 players each plus the coach. Other batches have to wait in the warm-up area. This area, the court, and other equipment are sanitized before and after use. Social distancing must be observed at all times. Players also have to bring their own drinking water. Eating inside the gym is prohibited as well. There's a designated safety officer to ensure compliance.
Isang symptoms lang like sipon or fever, they need to go to a doctor to get a clearance na hindi yun COVID. They need to get tested every 10 to 14 days. We have a mandatory.
Despite the restrictions, players are happy to be back on the hard court.
Nakakapanibago. Sumasakit ulit yung katawan ko.
After 2 decades of playing, veteran Sue Roses is thankful that she's finally a certified pro.
Bilang yun nga veterano na matagal na sa paglalaro, pinangarap ko rin to yung magkasama-sama lahat.
12 teams will be competing in the upcoming Open Conference on May 8. But the league is considering to push this back to late May to give way for more training. The conference will run for 2 months under a bubble setup at the Inspire Sports Academy in Laguna. Volleyball fans, however, won't get to watch the games live.
Unfortunately, spectators will not be allowed to watch. They're very strict about this, so they will only be able to view the games on television.
The Games and Amusement Board reminds the teams not to let their guard down and strictly follow health protocols. Gretchen Ho, we are One News.
In India, an 8-year-old Rubik's Cube enthusiast sets a new Guinness World Record by solving 3 puzzles at once in just 1 minute and 29.97 seconds. Holding a 3x3 cube on each hand and another with his 2 feet, Atharva Bhatt broke the previous Guinness record of 1 minute and 36 seconds. Bhatt now hopes to break his own record and finish in under a minute.
So hard to do that with 2 hands.
Wala talagang katarungan ng mundong to. No?
Grabe, no?
Biro mo, I can't even finish one.
Me too.
And he does it with his feet.
I'm sure Robbie probably can finish one, right? But you know,
That I'm not even
but you know, we have to keep safe with all the cases rising around us and take extra precaution. Definitely. And that wraps up today's big story. Catch us again tomorrow at 8 p.m. on Signal Channels 8 and 250.
So please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph. Mask on.
Wash hands.
And stay safe, Philippines. I'm Edwin Gao.
I'm Gretchen Ho, and we are One News. Have a good evening.